So good evening students. We'll be dealing with the mandibular nerve, which is the largest of the three divisions of the trigeminal nerve. It's a mixed nerve. It has a large sensory root and a small motor root. So mandibular nerve, sensory root passes downward from the trigeminal ganglion, enters foramen ovale. Below foramen ovale joins with motor root to form trunk of the mandibular nerve. So mandibular nerve area of supply is a sensory root supplies the skin of the lower lip, chin, part of cheek and temple, lower teeth and anterior two-thirds of the tongue. The motor root supplies the muscles of mastication along with the tensor tympani, tensor veli palatini, mylohyoid and anterior belly of digastric. You can see here this is the sensory component or the sensory root and the motor root. Both of them will pass through the foramen ovale, and immediately beneath the foramen ovale it forms the trunk of the mandibular nerve, which after a short course immediately divides into anterior division and posterior division. So in infratemporal fossa, mandibular nerve intervenes between the following structures. So medially there will be tensor veli palatini, laterally there will be lateral pterygoid muscle, behind there will be medial meningeal artery. So most important structure related to the mandibular nerve trunk will be the otic ganglion. It is sandwiched between mandibular trunk and tensor veli palatini muscles. You can see here this is the otic ganglion. So this is the motor root, this is the sensory root, both joining to form the trunk, and within a short course divides into anterior division and posterior division. So you can see these are the branches from anterior division. So there will be three motor and one sensory. One sensory will be going to the buccal region, supplying the skin and mucous membrane in relation to buccinator, and the three motor will be now to lateral pterygoid, now to masseter, and now to temporalis muscle. And you can see this is the posterior division branches. You can see this is the auriculotemporal nerve which encircles the middle meningeal artery, and you can see this is the inferior alveolar nerve, and this is the mylohyoid nerve, which is the only motor component passing through the inferior alveolar nerve. And you can see this is the lingual nerve, and you can see this is the chordae tympani nerve coming and joining the lingual nerve. So this chordae tympani carries the taste sensation from anterior two-thirds of tongue, and this carries the general sensations from the anterior two-thirds of the tongue. So branches of mandibular nerve from the trunk, meningeal branch, also called as nervus spinosus, passes through foramen spinosum along with middle meningeal artery, supplies dura mater of middle cranial fossa. Then now to medial pterygoid, supplies medial pterygoid muscle, provides few filaments which pass through otic ganglion without relay and supply tensor tympani and tensor veli palatini muscles. So mandibular nerve branches from the divisions are as follows. Like you can see here, the trunk divides into anterior and posterior divisions. Anterior division is having three motor and one sensory. So the motor or the masseteric nerve emerges through mandibular nerve, supplies masseter and temporomandibular joint. So deep temporal nerve supplying temporalis muscle. Now to lateral pterygoid, supplying the lateral pterygoid muscle. The sensory nerve is the buccal nerve. So it supplies skin and mucous membrane of the cheek. So from posterior division, three sensory branches. So namely the auriculotemporal nerve, lingual nerve and inferior alveolar nerve. And there is a motor branch also, which is a mylohyoid nerve. This is not coming from the posterior division, but it comes from the inferior alveolar nerve and supplies motor fibers to mylohyoid and anterior belly of digastric. First, let us deal with the auriculotemporal nerve. It arises by two roots, encircles middle meningeal artery, and later forms single trunk. So this is how we identify auriculotemporal nerve. You can see in this diagram. See here, it arises by two roots, then encircles middle meningeal artery, then forms a single trunk. This is the auriculotemporal nerve. So it passes backwards beneath lateral pterygoid muscle between neck of mandible and spinomandibular ligament. So lies above first part of maxillary artery, turns laterally behind temporomandibular joint, close to upper part of the parotid gland. Ascends behind superficial temporal vessels in relation to upper surface or base of parotid gland. So crosses posterior root of zygoma and enters temple and divides into superficial temporal branches. Receives communicating branch from otic ganglion which convey postganglionic secretomotor fibers to parotid gland. Auricular branches, they supply the tragus, auricle, roof and anterior wall of external acoustic meatus. Then cuticular layer of the tympanic membrane. Then superficial temporal branches supply skin of temple, and articular branches supply the temporomandibular joint. Then inferior alveolar nerve. So it has both sensory and motor fibers. Emerges from lower border of lateral pterygoid, passes downward between ramus and spinomandibular ligament, enters mandibular foramen, accompanies inferior alveolar vessels, runs in a bony canal below the teeth of the mandible, then finally divides into incisive and mental nerves. So trunk supplies molar and premolar teeth, inferior dental plexus. Incisive nerve supplies canine and incisor teeth. Mental nerve passes through mental foramen, supplies skin of chin and lower lip. Then mylohyoid nerve, motor nerve, arises from inferior alveolar nerve before it enters into mandibular foramen, pierces phenomandibular ligament, runs below mylohyoid muscle, supplies mylohyoid and anterior belly of digastric muscle. So frequently communicating branch joins inferior alveolar nerve with lingual nerve. So this we have seen today in the dissection. So then lingual nerve, so lies in front of the inferior alveolar nerve, receives caudate tympani nerve, so which conveys taste sensation from anterior two-third of the tongue, emerges from lower border of lateral pterygoid, passes downward and forward between ramus and medial pterygoid, then medial to third molar, it comes in direct contact with the mandible, intervenes between origin of superior constrictor and mylohyoid muscle. Here it is covered only by the mucous membrane and is palpable 1 cm below and behind third molar. So it crosses styloglossus muscle, rests on hyoglossus muscle. Submandibular ganglion is suspended from lower border of the nerve by two roots, secretomotor fibers to submandibular and sublingual glands. So winds around lower border of submandibular duct, supplies anterior two-third of the tongue, floor of mouth and mandibular gum. So receives communication from hypoglossal nerve, proprioception from tongue muscles. So clinical aspect related to the mandibular nerve is the mandibular nerve block. So mandibular nerve is blocked by injecting local anesthetic agent through a needle 4 centimeters deep to mandibular notch as a treatment of trigeminal neuralgia due to affected mandibular division. Thank you.